Hi, I'm Dr. Santoshi. I'm a consultant dermatologist at Aesthetica Veda, Whitefield, Bangalore. Today I'll be talking about acne surgeries. Now, as you know, acne is not the real deal. The surgery, the scars that it leaves behind are what's most traumatic because they're harder to treat. Now, not many of you know that there are surgeries that can be done on patients with acne. And that depends on the kind of acne that the patient has. So for example, if someone is having comedones, then there is a form of acne surgery called comedone extraction. Now this should be done carefully because some people may develop secondary infection which sometimes may be unavoidable, and also they can develop scarring, redness, etc. So it should be done by a professional in a professional setting, and if needed an antibiotic topical or oral may be prescribed as an adjunct to it, and never apply undue pressure over the comedone to extract it because it's just going to do more harm than good. And the thing is, if you extract the comedones, it results in faster resolution because it gets rid of the foci of inflammation and it gets rid of potential pus-filled lesions. And of course, comedones should be extracted before you put the patient on retinoid therapy, which is isotretinoin, because isotretinoin therapy on a patient with comedones will result in a full-blown flare of pustular acne. Second, if someone is having pus-filled lesions, the other end of the spectrum, nodulocystic acne, the cyst can be drained with incision and drainage, and the wall of the cyst can be cauterized with phenol, and it can be neutralized with the povidone iodine, and this can be followed up with a diluted injection of triamcinolone 5 mg per ml to 10 mg per ml inside the lesion and perilesionally to reduce the inflammation, because acne is not just a disease of infection, it's a disease primarily of inflammation, and the inflammation is what results in scarring. All right, so the redness, longer the lesion lasts, more red it is, all these are pointers towards the risk of scarring. Then there are other surgeries once the scar has already formed. Of course, when it's just onto the surface, in level with the surface, and it's just a color change, peels can really help. There are peels of salicylic acid, of glycolic acid, mandelic acid, trichloroacetic acid. Trichloroacetic acid has to be used with caution, especially in people of color, because it can result in post-inflammatory hyperpigmentation. And then we have light-based therapies, and light-based therapies, especially when there's a color change, 𝐸𝐸𝐸𝐿 lasers which target the pigmentation, that can be used. And when there is change in the surface, that's when we get atrophic scars. Okay, they can be box scars, rolling scars, ice pick scars. So TCA Cross technique can be used, where at the tip of a toothpick at least 50 to 100% TCA is picked up and it is introduced into the very depth of the ice pick scar. The problem is, again, this has to be done by a professional. If used in skin of color inappropriately, it can result in post-inflammatory hyperpigmentation. And then we have punch elevation, punch excision techniques. So what happens is the scar is usually depressed compared to the rest of the level of the skin, right? So we excise the scar completely, or we excise it and re-implant it at a level higher than the surrounding skin, so that when it heals, it comes back in level with the skin. There's also a procedure called subcision, which is pretty effective, not widely practiced. You introduce a 18-gauge needle or an 𝐸𝐞𝐭𝐚𝐢𝐿 needle, and in the subcutaneous tissue, you will hear an audible snapping sound and you'll feel the resistance give way while you do it. That can give rise to immediate results because you, in the sense, not with one session, but at least 1 or 2, 3 sessions, it will result in elevation of the skin. First of all, it will homogenize the adipose tissue underlying the fat tissue, so that will kind of redistribute the adipose tissue and filling up will happen. And of course, of this followed with PRP, which is platelet rich plasma, will give wonderful results. And of course, there are lasers and energy based devices, blue light, intense pulse light, and pulse dye laser, and ablative carbon dioxide. All of these lasers can be employed to resurface the area. Ablative carbon dioxide acts on water molecules that they take up the energy and results in microthermal zones, and this results in controlled damage. All right, this controlled damage results in collagen proliferation, which acts in filling up the scars. It's also a mode of skin rejuvenation. So yes, consult your nearest dermatologist to know more about these procedures. And gone are the days when you have to sit and suffer with the scars. There are so many procedures that have come up, and step in to get the right treatment done for you. Thank you.